Good afternoon. My name is Lenz. I'm the founder and publisher of Catalyst Chicago, and I'm really happy to be here. After almost 23 years of reporting pretty much full-time on Chicago public schools, we at Catalyst are actually beginning to think about expanding our focus into other arenas that affect children's academic achievement as well as their well-being, and this is the place to be for that, right? And we're actually here in Forest. Lane Forte, the editor, is here, and Rebecca Harris, our early childhood reporter and tweeter-in-chief, and she's tweeting away, is here. So thank you very much, and this is fabulous timing for us personally. As you can see from the program, this panel, welcome. Thank you. Glad you're has a challenging topic, which I sort of see as figuring out how we all work together given the resources we have, and that's no mean feat. I'm pretty sure that you all know the speakers and what they do, so I picked out a few items from their bios of things maybe you don't know about them. Chris Koch has been the Illinois State Superintendent of Education since 2006 and has worked at the State Board of Education since 1994. Coherence has been a focus for him. Coherence among state learning standards, curriculum, assessments, and college entrance requirements. On the national level, he has held several positions with the Council of Chief State School Officers, including president, and he began his career as a special education teacher. Michelle Sadler has been Secretary of the Illinois Department of Human Services for a little over 2 years, and her background is management and finance. Previously, she was Executive Director of the Illinois Metropolitan Investment Fund, tending investments from different municipalities in the area, and was Executive Vice President of the Mid-American Leadership Foundation. She also has held leadership positions in social justice organizations, including Protestants for the Common Good and the Chicago Coalition for the Homeless. Beth Swanson is Mayor Rahm Emanuel's Deputy Mayor for Education. In that post, she is responsible for defining and leading the city's policy agenda for learning in preschool, K-12 schools, and city colleges. Beth advised the mayor during his campaign and then led his education transition team. Previously, she was the executive director of the Pritzker-Trauber Family Foundation, which of course invests heavily in education. And prior to joining the foundation, Beth was served in R.E. Duncan School Administration as chief of the Office of Management and Budget, and prior to that, the Office of Extended Learning Opportunities, which is one clear point of intersection between the city and the state, and then the city and the school district. Before we start, one point of housekeeping. There are note cards and pens on your tables. We'll take questions both from the floor and in writing after some presentations here. If you want to increase the chances of your question being asked, please write it down. Hold up your hand and someone will pick it up and deliver it to me. And write legibly, please. I dropped my watch on the floor, my timekeeping, so I have to dive down to get it. But we'll welcome first Chris Koch, and then Michelle, and then Beth. Excuse me.
Good afternoon, everyone. Pleased to be here. I know that you already heard from Raina Hernandez on my staff today about some of the reforms we're doing, so I'll just give you some brief overview of kind of where we're at as we're setting up for yet another budget season, which Michelle and I, it's our favorite time of year, as you can imagine, is getting ready for the budget season. And Beth, I'm sure, enjoys this as well. First of all, we've worked really hard at our agency to protect the investment of early childhood. We have seen reductions. I'm going to talk a little bit about what those have been and the impact of those. But we have seen it as a priority. Our board consistently sees early childhood as a priority, and I believe we'll continue to see it as a major priority, including this year. We have developed and invested in some high-quality programs, early childhood, birth to 5, through the early childhood block grants that we have, and we're continuing to push for infrastructure improvements to early childhood services, and we're doing this through our role in the Early Learning Council, the Early Learning Challenge grant that we've worked together on, where we did some cross-agency planning. This issue that Ruby referenced in terms of a long-term vision is certainly one that we have. We've been working very hard on infrastructure over these last 5 years. As you know, I'm a proponent for data use and collecting and having quality data. And I believe we have an obligation to ensure that our services for children that they receive from us are aligned and streamlined, and that there are seamless transitions. We can't do that without these kinds of data systems. We've made reforms in how kids receive services that they need at every stage of a continuum, and there's many opportunities here we have for cross-pollination. We are getting richer data into our longitudinal data system. As you know, this is a data system that we've been developing through federal money. Much of our reform education work that we've been doing the last 3 years has been solely tied to federal dollars. There's been no state dollars attributed to this. The ISBE birth to 3 services are already part of the existing student information system that we have. You might recall me talking about microchipping infants and how I was interested in doing that. See? I delivered. Not really. Don't panic. We're working with other agencies to build infrastructure that will connect data. And we're also working and incorporating early childhood into something called the Illinois Shared Learning Environment Project. And this is a technology-mediated instructional support that helps bring data together with instructional resources. It's a part of our Early Learning Challenge Round Grant 2. We have this incorporated as part of that. I'm particularly fond of it because I believe it will lead us to an environment of personalized learning for each and every student, one in which teachers do not have to work to gain access to high-quality curriculum and materials. It's also an open-source medium, so it's constantly improving based on the use by other practitioners. As you know, we're working on the Kindergarten Individual Development Survey, and this is a major bridge between early childhood and K-12. That's very important. It's aligned to our kindergarten standards as well as early learning and development standards, and it reflects the Common Core as well as whole child development. The instrument currently includes 5 domains, and we're developing a 6th. English language development, self and social development, self-regulation, language and literacy development, and mathematical development. Physical development's in progress. So we have a developmentally appropriate observational tool designed to inform instruction, much like many of the child assessment tools already used in early childhood classrooms, such as work sampling. It's important to bring a new level of data and understanding about where our children are prior to 3rd grade, and we fully understand that. We broaden our goals for child outcomes beyond focusing on academics. We recognize the importance of social-emotional development through the K-12 social-emotional learning standards, which we are supporting and implementing through our school improvement work around conditions for learning. We have just developed a Center for School Improvement with early childhood represented on the Roundtable Leadership Team to support schools and build strong learning environments and family-home partnerships. We'll also be administering the 5 Essential Survey in all schools, which recognizes the importance of supporting learning environments and involved families to achieving child outcomes, in addition to effective leaders, collaborative teachers, and ambitious instruction. For the first time, school districts will be surveying all their teachers, all their students and parents about how they feel their schools are providing services. We're going to continue to look for ways to bridge educational experiences in order to best serve children. And we certainly have these strengths to build on. I do want to just reflect on what's happened the last 2 years in terms of services and give you a little perspective, too, on how this looks from a school district perspective. So in FY12, our early childhood block grant appropriation was reduced by $55 million since 2009, and that further decreased then to $80 million less than in FY09 and FY13. This has resulted in, it was 18,000 fewer students being served, and we added 4,000 fewer students served last year, and these are slots statewide, and this included at least 2,000 fewer children in birth to 3 receiving prevention initiative services, which are part of our grant. Our school districts, for the first time, encountered a proration to general state aid. Ruby had referenced the general early childhood funds being part of general revenue. I think that is a good idea. It's one in which we've had some conversations with the governor's office about pursuing and something that I think needs to be looked at in the state. Nonetheless, if it were part of general state aid, it would have received a proration and reduced funding last year. This means that school districts have a very difficult time planning, budgeting, and that they have to, in many cases, proactively lay off personnel in order to make sure that they can make ends meet at the end of the next year. We are continually trying to make sure that legislators are educated about the impact of these services. We are seeing increased wait lists all across the state for early childhood services. So I'm anxious to work together on some ideas of how to approach the budget this year. We did start our budget hearings 2 weeks ago in Southland Charter Schools, where we had our first budget hearing, and then in Champaign we'll be having one in Chicago, and we have also just an email address where you can send comments to the state board around budget priorities that you're interested in. And with that, I'll pass on the mic. Thank you, Michelle.
Thank you, Chris. Son? Sounds like it. Hi, everybody. My name is Michelle Sadler, and just to clarify a little bit about my background through the flow of the bio that we send around, yes, I have a management and finance background, which is kind of odd. Did investments for decades, but after a while I realized that what I was really financing was my volunteer work. And found, you've heard about 80-hour weeks. I would put in, say, 40 hours with my day job and then go to my evening job, working at the Chicago Coalition for the Homeless, or Protestants for the Common Good, or Evanston Day Nursery, or what have you, to the point where it got to the 80-hour weeks and I was dragging my children along. They became activists themselves. And so I had this parallel career and finally realized that finance was really kind of boring to me after a long time. Went into full-time, more mission-focused work. I worked at a grassroots economic development ministry. I ran the LifeLink International Adoption Agency, which actually did the most placements in the state for a long time. And by eventually came to Governor Quinn as he was about to transition and asked if I could volunteer for him in policy work. And he said, no, don't volunteer, come and work for me. So I became his director of policy. And after a year working with him, he offered me the opportunity to work with the Department of Human Services. And what an incredible opportunity, because the Department of Human Services touches on so many program areas and works with so many people and partners around the state in many different areas. So I guess part of what I want to talk about today is partnership, because at the Department of Human Services we really believe in partnership. Only 1/4 of our budget covers what we do internally, our staff and the hospitals, the state-operated developmental centers that we actually run. 3/4 of the pie really are grant dollars that go to our partners, our child care assistance providers, our prevention partners, etc. So partnership's very important. And when we talk about an early learning system, partnership is really, really integral. That's what it's all about. It's about a comprehensive system that's coordinated and that's collaborative. So as I walked into the hotel, there was actually someone on the way out who shall remain nameless, couldn't be here for the session, but she said, first of all, I missed this morning's session because I had a meeting with Jerry Sturmer that couldn't be rescheduled, former executive director of Voices for Young Children. So that's where I was, and I was hoping that you guys would understand that particular excuse. I was with Jerry the whole time. Well, anyway, the person as I was walking in, who was walking out, I said, well, how'd the morning go? She said, it was great. I said, was there anything in particular that struck you? So you all will know who said this, I think. And she said, what really struck me was that one speaker talked about an apple pie. Do you guys remember this analogy? There you go. And she said, it's really about the apple pie. It's not a bushel of apples, but it's about making those apples into a pie. And there are lots of different ingredients, and it's about all the ingredients working together to produce a comprehensive system of early childhood learning and development. So it's about the system. So I'd like to do maybe 4 things. 3 if someone gives me the sign. The first is to introduce you to some of the resources, because you go to a conference, I go to conferences, I listen to people, I take some notes I remember and I refer to. But what's important sometimes is to have resources to go back to. You know, you'll call that person, you'll call Chris and say, "No, can you tell me about such and such?" So human resources. First of all, I'd like to introduce, let me introduce the governor's office first. And I don't know if you've been introduced, but when we talk about a comprehensive system, please remember that the Early Learning Council was created by legislation, but a lot of what we do works with the Office of Early Childhood Development, which was established by Governor Quinn in 2009. So this is a governor who supports early childhood development and has established this office specifically in the governor's office to strengthen our efforts to have a comprehensive statewide system for early child care and education. First of all, Teresa Hawley. Teresa, just wave. Teresa Hawley is our senior advisor at the Office of Early Childhood Development. Teresa Kelly, Teresa, could you wave your hand, is the project director of our Strong Foundations Partnership, which is our large home visiting partnership statewide. And she is heading us up and giving us direction on our McVie program. If you are part of the McVie program here, raise your hand. I'm just going to ask you to. Thank you. This is the Maternal, Infant, and Early Childhood Home Visiting Program that we are working on. Kim Collins, project manager with the State Advisory Council grant, and she does everything. And I don't think Amber Kirchhoff is here. So Teresa, and Kim are our resources in the governor's office. Next, secretaries come and go, regretfully. I wish I could be around a long time. But there are people on staff who do this work every single day, and I want to introduce you to the two people on the DHS staff that you must remember. If you don't remember the rest of what I say, remember these two people. Number one, Dan Harris. Dan is our Associate Director of the Division of Children and Family Services. He is essentially over all of our prevention programs, youth programs, you name it, violence programs, all of our prevention programs, and this will be meaningful for you. We kind of stole him from the ounce of prevention. So that's Dan Harris. And Linda Satterfield, Linda, could you Linda is actually now Dan's boss, and she actually said we should steal him, as did some others. She is the director of our Division of Family and Community Services, and historically she has been the director of the state's Child Care Assistance Program. So whenever I have a question about child care, about early learning, about all of our many programs dealing with maternal and child health, dealing with youth intervention, I go to Linda or I go to Dan. So that's the first thing I want to do. Those are our resources that you want to remember going forward. Some other things that maybe I'll talk about, I'd like to talk about the state's race to the top, involvement. Next, I'll talk about this whole shift from, we've gone from birth to 3, we've gone then to birth to 5, now we're talking about birth to 8, and I want to talk about that a little bit and its implications for us as a state. And last, perhaps, I think I'll have some time to talk about other agency streamlining efforts. This is all, as I said, about partnership. Race to the Top, Early Learning Challenge. In Phase 1, you all may recall, we had an opportunity to apply for some grants to strengthen our early learning systems through data systems, development of comprehensive data systems, professional development, and family engagement. Well, we didn't get that particular grant, but we have a second bite at the apple, a second opportunity at a bite of the apple pie through the Race to the Top Phase 2, offered by the U.S. Department of Education and the Department of Health and Human Services. These departments, these federal departments, essentially invited the next 5 highest-ranking states to apply for the second phase. And Illinois is eligible to apply for and receive up to $35 million during this round. And the funds will be distributed by the end of this calendar year. We've worked very closely with the governor's office on this, and the strategic priorities that we've put together kind of mirror and illustrate the priorities of our Early Learning Council in ensuring a comprehensive, high-quality system that prioritizes children with high needs and families that are hard to reach. The first priority, the first strategic reform priority is really partnership. It's deepening the integration of state supports for greater integration across multiple funding streams and agencies. So collaboration. This is about making sure that as state agencies, and then in turn as a system, a partnership of an early learning system, that we don't have redundancy, that we don't duplicate efforts across state agencies. This priority is about making sure that the right hand, or from your perspective, the left, knows what the other hand, thank you, what the other hand is doing. So, very cleverly, led by the Office of the Early Childhood Development, we have the Office of the Early Childhood Development and the 2 co-chairs of the Early Learning Council. We have the leadership team. And the leadership team is made up of the agency directors of the State Board of Ed, DHS, and DCFS, together with the Early Learning Council co-chairs, Julie Smith from the Governor's Office and Harriet Myers from ONSEF Prevention. Yes. And we met every single week, granted by phone, but every single week as the Race to the Top application was put together. So there's collaboration. We know what one another are doing. Then, in addition to the leadership team, there's an interagency team made up of the leaders of the agency divisions that are focused on early childhood. In addition, there are some interagency project teams, right? Now, we're still talking about strengthening and deepening collaboration and integration. We have interagency project teams led by these guys, again, on QRIS implementation, on workforce development, on community collaboration, and on data and outcomes measurement. All right, so that's good. The agency, the real knowledgeable people are working interactively, and there's a parallel system of committees focused on these same 4 priorities. So as you see, there are methods for integration and communication here, integration and communication at the real staff level, integration and communication at the provider advocacy level. So this feeds into this, apple pie, right? So, strategic reform priority number 2 is connecting the most at-risk children with the supports and services that they need. This is really, again, about collaboration. It's about recognizing that the state cannot fund or do everything, and that communities know best how to serve their communities. And you all have over time been putting together coalitions. And so we as a state want to learn from you and help bring evidence-based practices and training to the coalitions that exist in the state. We are providing websites, training materials, and technical assistance models to the collaborations that exist, and we will be putting together six pilot projects in communities where children are hard to reach, and we'll be working with them and other collaborations to generate and identify effective strategies for engaging at-risk children and their families in high-quality services at the local level. Excuse me. Strategy 1 was integration, collaboration. Strategy 2 was connecting at-risk children with the supports they need. And strategy 3, the last one that I'm going to talk about, is increasing program quality. Increasing program quality across the state from adequate to good, and then once a program is at the good level, from good to great. from adequate to good, and from good to great. We are bringing people from the most basic licensing standards up to much higher levels as identified by the quality rating and improvement system. We're adding 16 quality specialists to our 16 CCR&R child care resource and referral agencies. We'll have trainings, and again here, there will be 6 to 8 high-need communities for where we will focus some of these efforts. We have a year for all of these planning initiatives, and then the strategies and priorities and techniques, methodologies, best practices that are identified will be implemented at the beginning of 2014. That's what's going on with Race to the Top, and I hope that you all will be a part of it. So I wish us all well. Let me talk now, though, about what's going on at the Department of Human Services and how we work with all of you and with our brother and sister agencies. The Division of Family and Community Services, and I've probably been saying it wrong, but the Division of Family and Community Services has about 34 programs for children and families. It's really quite a comprehensive scope of range of programs. You can visualize these programs if you think back to algebra, right? You have the x-axis and you have the y-axis, right? And so along the x-axis, here from your perspective, along the x-axis, let's say prenatal, is age 0 at one end of the spectrum. Then it goes on to infants, toddlers, preschool, school-age children, teens, adults, seniors, all the way to beyond when a person passes through our funeral and burial program. So, from womb to tomb. Sorry. Never said that before publicly. Just heard it the first time last night. Might be your last. Yeah, it might be the last time I say it. Right? Thank you. A former pastor said, thank you, that's really much better. A former pastor said, we'll marry you and bury you. But, so an age spectrum along the bottom of this, and then in terms of the y-axis, we have levels of engagement from basic supports, food, housing, cash assistance. The next and very, very important level of engagement, development and prevention, primary prevention and development for youth. Then we go on to early intervention and the more intervention type programs. Then beyond that, we get into treatment programs. We talk about addiction prevention, and then we have programs for justice-involved youth. So quite a spectrum. We are there. We as state agencies are here to offer the supports that a person needs at any point in their life. But similarly, we're also there to step back once a person has reached self-sufficiency. So it is a flexible provision of services that's there for when the times are appropriate and when they are needed. So it's a system of supports. As we broaden our focus to 0 to 8, from 0 to 5, our concern, we were asked, how do you feel about the broadening, the expansion of this focus? And our concern would be an overstatement, but I would say that as we broaden our focus, we have concerns that you lose, in a programmatic sense, there's a concern that you might lose your more intensive focus that you previously had. And at the state level particularly, there's always a danger that your resources will shift. However, that's okay as long as you have in mind, as long as we have in mind all the time, what are the desired outcomes? And as long as we are investing in the programs that give us those desired outcomes, hence all of the data systems that Chris and others and we are involved in developing, that's so important. We have to have the data systems to make sure that the programs we're investing in are giving us the outcomes that we want, right? So that's all okay. We know what your desired outcomes are, invest in programs that produce those outcomes, and have the data systems to loop those reports back. So more specifically at DHS, as we focus and as we incorporate what we call a budgeting for results perspective, we have some bedrock programs. We have the Child Care Assistance Program, of course. We have what I mentioned, the Maternal, Infant, and Early Childhood Home Visiting Program, which is an evidence-based home visitation program that so many people are involved with. And we have Family Case Management and some other programs. I talked about this feedback, this data feedback. In family case management, we're engaged in a process of really trying to figure out how best to design this critical program. We are receiving input from all of you and a wide array of stakeholders to find out what would be the best way of designing this. We have a grant application in to the NGA, the National Governors Association, to bring in some subject matter experts. So we're revisiting this program. This year, we are using data even more in this is just one example, our targeted prenatal intensive case management program. We're working collaboratively with the Department of Public Health to receive vital records, and these vital records are being used to target our efforts and to target this investment in community areas and counties where there's a preponderance of poor birth outcomes. We're partnering with Healthcare and Family Services and using Medicaid claims data to further target the outreach effort of the agencies in these communities. So, collaboration and partnership is really what it's all about. At DHS, the executive staff members and we as an agency have some guiding principles that we call PRIDE. And we have an overall culture of caring. It sounds very corny, but I hope that you all can relate with this. My mother always says she's earnest, she's sincere if nothing else. That's what my mother says about me. So we have an overall culture of caring. And then we have guiding principles written out by PRIDE. P stands for partnership. We talked about that. R for rebalancing, and we as a state are moving from institutional care more towards community-based care. R for rebalancing. I for integrated delivery of human services, where we can treat people and not just as applicants to one program or another program. D for data-driven program evaluation, and E for effective core human services. We, as a community, need to fight to make sure that the basic core human services that we believe in have a place and an appropriate place of strength in the state budget. So partnership is what we've talked about. Partnership is very important. I'm going to share just a couple of other things in terms of partnership and other interagency streamlining efforts. This will have to do with any of you who partner or contract with the state. One of the things we've done recently is establish a CRV, a centralized repository vault. If you report to the state, instead of reporting to as many as 5 different DHS divisions and as many as 5 different human service agencies, there's one place where you can now sign up to upload all of your reports and your central information, all of your board information, your articles of incorporation, just once, and we will all share it. So that's gotten started, and we have close to 1,600 providers signed up. That's the first thing. The second thing is a uniform budget and financial reporting system. And we are looking for a name, like a catchy name, to brand this and market it and to talk about it. But it's really reducing the bureaucracy that you guys have to deal with. At the beginning of the year, providers have to submit a budget. Not child care providers, but contractual providers to the state, grant recipients, etc. They have to provide a budget at the beginning of the year. And at the end of the year, they have to report on their financials, right? So, again, instead of giving financial reports to the many different state entities in many different formats, we have partnered with our sister and brother agencies and have agreed on one template for financial reporting at the end of the year. This is very, very, very new. This is the first place it's ever been announced. And there will be uniform formatting for year-end reporting, and it'll probably take a little phasing in, uniform reporting of your budget at the beginning of your grant contract. We are working very closely with the State Board of Education on this, and in fact, it's their template that we're using. It will essentially be the consolidated financial report template, and that's what it is, uniform budgeting and financial reporting to all state agencies. And last, talk about CRV, talk about uniform reporting. Last is, it's kind of dry, but it's important, centralization of the audit report review. So right now, if you have an audit, raise your hands if your organization has an audit. Audits, 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 and they're very important. But if you work with a number of state agencies or state divisions, we all have to review your audit, and each of us might give you some sort of comments or corrective action. Well, we found that there are at least 10,507 providers that we found already that work with 2 or more human service agencies. And we've figured that there are at least, at a minimum, 50,000 unnecessary reviews of your audit, redundant. And so we are centralizing this function, and so providers will only have one corrective action plan, and we've agreed to the checklist and will utilize the centralized repository vault to do so. So thank you very much. Please remember our partners at the Governor's Office. Please remember Dan Harris and Linda Satterfield's names. Wish us all well. I wish us all well on Race to the Top. We are very comfortable with the shift to 0 to 8 as long as we keep our eye on our outcomes, and we at DHS are very excited to continue even deeper collaboration with our sister agencies and with all of you. Thank you.
So you want to step up the lectern?
Do you want me to?
Yeah, I think so.
All right.
From here back.
Or do you want me to? Thank you. Thanks. So good afternoon. Thank you for having me on this panel. I was going to spend a little bit of time on state perspective about the city and just let folks know what we've been up to in the city of Chicago in the early learning, at least from the mayor's office. As Linda mentioned, I'm Beth Swanson. I'm the mayor's deputy on education, and that role is to help set his policy priorities from I was going to say, I'll come up, it's not womb to tomb, but more cradle to career, or, I stopped short of the grave. Hopefully for a long time, actually. Really what we did is we looked at this work, and early childhood was always a priority within our education agenda since the campaign, and then during the transition period, and now the last 18 months in office. But we put together some simple but bold sort of visions around education, but really it's to provide children in the city of Chicago and every single community access and options to the highest of quality of education starting at birth. We have a couple of goals around increasing not only quality but access in our work, and particularly in our early childhood work. And I just wanted to go over some of the major efforts underway this year, and then sort of some of the things coming forward after that. But one of the things was investment. We just went through our city budget process, which is always fun. But one of the priorities that was announced by the mayor was an additional $10 million from the city's revenue to expand early childhood slots in the city of Chicago. So 5,000 more slots to children throughout the city of Chicago, which is great. And another 6,000 slots sort of being enhanced by wraparound services, parent engagement, and other things like of that nature as well. Thank you. So, aside from just talking about it, he's trying to put his money where his mouth is and really expand this. And most of the funding has been in DFSS, or Department of Family Services, or Chicago Public Schools. But he felt like putting this in the city budget it's a recurring revenue source, and that will be going, that program will grow, we hope, over the years as well. So that's an exciting new endeavor. As a part of that, not only additional investment, but we are looking at both the Department of Family Services and Chicago Public Schools about how we can more strategically invest in early childhood. In the past, sort of slots have been allocated, et cetera, more in parallel than in coordination. And so one of the things I've been trying to do and facilitate in the city is to have our agencies that own a number of the slots or a bulk of the funds to think about it more strategically together to better serve the city as a whole. So we have a number of working groups underway. We also launched an early learning council for the city of Chicago to bring those not only our sort of different bureaucracies together, but a lot of our major partners in the city around early childhood to come influence that work and think about it more strategically. So for the first time, CPS and the Department of Family Services released a coordinated set of applications for early childhood this year. To, again, ensure that all children have access to the highest quality of learning. Beginning in the 2013-14 year, that's when all of the sort of new selection will be settled and available for parents. The community-based applications are already in. We have our school-based applications coming over the next week. It's just a great opportunity to really look at the city and understand where the children are, where the need is, how to get the right programs to the right communities. And we also opened it for the first time beyond sort of our traditional partners, but charter schools had access to the funding, archdiocese, private providers, and others to really come together and to have a lens more about quality rather than type of provider. So we're trying to say the highest of quality programs should be available to all our children. So we'll see how that plays out over the next many months as we award that and review that. The second major, one other note I wanted to mention is that the principals, and again, this bleeds into our K-12 strategy, but school-based principals actually had to apply and put together a pre-K or early childhood plan for the funding. In the past, it hasn't necessarily been the case, and as someone who's at one currently in Chicago Public Schools preschool program, but two others who have gone through the system. My three children, I've seen it very different in different schools depending on the principal and how they look at early childhood, how they integrate it into their school, or if they don't. I had one child participate in an early childhood program that was in an annex of a building. It was sort of the 3 and 4-year-olds are in one spot, the rest of the school is functioning almost as two totally separate entities. Other principals look at it very, very differently and have an integrated structure and have that pre-K and the 3 and 4-year-olds integrated into all they do in that school, and it's just a tremendous difference. And access to all the school's resources and programs and counselors, et cetera. So having seen it just actually in my own little sample of 3, I can really see the difference. And one thing we're trying to get to have principals think and feel accountable for those 3 and 4-year-olds and as they move through the pipeline of public education in Chicago. So I think aside from trying to make this streamlined and a bit easier for everyone applying, we're also seeing some other additional benefits to having people go through this new process and really lay down a plan that's much more comprehensive for children. Another major emphasis is empowering parents, and that is something we've talked about for many months, but not only in K-12, but the early childhood as well. We did design and launch right now it's a beta version of a citywide early learning portal, but the idea is to have an integrated website and portal for parents, specifically as an audience, to come and learn about early childhood opportunities in their communities, in their neighborhood, be able to compare quality of providers, quality of programs and options, and educate them as more of a consumer of where they would like to bring their children and have their children enrolled. So right now we're going through that. A number of our partners are on that site giving us feedback, et cetera, and we're going to keep improving that and eventually launch it more publicly. But it will include resources, quality rating of all of the different programs, et cetera. So again, trying to be more transparent and trying to provide parents with much more information and helping them make the right selection for their child and their education opportunities. A lot of other things that were on tap and coming down the pipeline is where, again, with the idea of more coordinated efforts, more strategic efforts in the city, and all the entities that manage the early childhood for us. But Chicago Public Schools and DFSS are also working towards using same assessment and evaluation tools. We're seeing that there's a number of different tools, a number of different assessments, reporting, as you're talking about reporting, that all the providers are dealing with. We're trying to work towards, with the goal of having the same assessment evaluation tools for developmental screening, child-teacher interaction, child outcomes, et cetera. So again, if a provider has city money, a parent will know, here are the outcomes, here's the goal for these programs, here are the outcomes expected, here are the quality metrics, et cetera. So you know the value of what you're getting. Family and community engagement will continue to be a thrust of what we're doing. We're looking at Chicago Public Schools and how they're structuring. They have a new Office of Family and Community Engagement there. Really high-level overviews. The city and CPS sort of breaks it up into various networks or sort of regional groupings of schools. We've got these network offices out throughout the city. We would like a family and community engagement, not only person at each of those regional offices, but to have early childhood as one of their major tenets of their work, and to be a conduit to the community and the providers in that community, and leverage the good practices happening and all the early childhood providers in that community, and again, sort of integrate that into how CPS is moving forward. So we're worried about the pipeline also coming into the public schools, but to start those relationships very, very early with providers and have a more seamless integration of them into the K-12 system as well. I know we are very short on time for questions, right?
Do we go to?
Yeah.
Why not? We go till 2:30.
Okay, I'm trying to leave time. So, the other thing I wanted to mention also was one of our exemplars in the city is the Chicago's Child Parent Centers, which does combine a number of things I've talked about, actually, but Child Parent Centers providing comprehensive, high-quality services to our preschool children and their parents who live in targeted low-income areas for 2 years. And that's those types of things, and I talked to a number of providers, local and community-based providers, about how they engage parents and how they work with parents, and not only serving the child, but the parents as well, and we are making that a priority going forward. And the parent centers, they currently operate 10 programs, and they'll continue to be funded and really become a national model for other cities as well. But parents enrolling their children for 2 years, they begin all the basic development of reading, writing, math, etc. But there's also within the elementary school building, so again, we're also trying to use our elementary school buildings, have our parents as true partners within the school, within their child's education. And then it also requires parent involvement in parent rooms for classroom activities, etc. So again, trying to take some of the lessons learned from some of our best practices and try to spread those into additional early childhood programs throughout the city. I think I will stop there. I think we're off to a great start. This past year, we've got a lot of new initiatives rolling in early childhood. A lot of things will come from our when we start awarding the rounds of applicants for the early childhood, and we're going to keep pushing forward with many of you in this room and many of our partners to make all of this come to fruition. So, thanks very much.
Great. I was surprised to hear much you all talk to each other and work together, which is really very encouraging. We have a question, and it's very legibly written. It's for Beth. When will the Early Childhood Education Parent Portal be available to all stakeholders?
That's a good question. Right now, it's in beta form. We are trying to get it out the door, I hope, very, very shortly. Looking at do you have an actual date? The Childhood Guru. No, so I am pushing to have it open shortly. It feels ready for me, from my perspective, ready to get launched. So we're trying to get it out the door. So hopefully, within weeks, I hope to have news on that. I'm reading this on the screen here.
What happens to a school if a principal is not invested in early childhood education? What happens to a community when you have 4 schools in a community that are not, 4 schools in the community that are not invested in early childhood?
So we have a new early childhood education leader at Chicago Public Schools, and she is very much involved in this project and helping us, and shares our belief that early childhood is absolutely critical to all of our children and all of our communities. So there's an intensive effort working actually with the principals in Chicago Public Schools and around early childhood, the goal and the vision of the system and of the mayor. So we believe going forward, the principals will understand sort of, this vision and this priority, and there will be supports for those schools who perhaps don't have early childhood yet, or et cetera, or might not share that vision at the moment. But so I know CPS is prioritizing it and working not only with the network chiefs, the chiefs of schools, but also the principals to ensure that they're a part of this and a part of this rollout and helping us expand these programs. We are going to work through that process right now, looking at what applications are in. There's an external set of reviewers. There's a public rubric on the website that can tell folks how these programs are being looked at, et cetera, including our schools. So the idea with having CPS and DFSS sit down and strategically award and allocate is to make sure every community does have high-quality early childhood options in it. So the system and the process is supposed to not allow that to have a deficit in the community.
What can be done to secure more funding from a wider variety of sources for the state's full-service community schools, which develop partnerships to help schools reduce barriers to learning and increase parent and community engagement? Where do we get more money?
Do you want me to take a stab at more money? Good question. So, as I mentioned in my comments, there's a lot of things bearing down here, and Ruby would reference this too. We have far more kids in poverty in the state every year, and the majority of our school districts, as an example, over 40% of kids who are in poverty, and that, of course, lends itself to families, and that draws more and more money down, even in the formulas that exist. It takes more to maintain and serve students higher in need, and I'm just setting that as a context, not where we get more money, but the fact that a lot of our existing money is being pulled in those directions. So in the general state aid formula, as an example, there are 2 components to that. One is the poverty grant, which has grown exponentially if you look at this over years. The other is the money that's used to offset the counties that have property tax limitations. So the state offsets that amount. That amount has grown. It's over $600 million now. We believe there are some opportunities in thinking differently about the formula that we've used for a long time in the state, and that should be looked at. And I know there's other groups in the state. We've had conversations with the governor's office, certainly the P20 Council. Just at our state board meeting last week, we discussed this, and we would like to, not for this legislative season, but certainly to look at that formula. Now, that should include also revenue sources, because we rank 50 out of 50 in terms of the state's contribution to education. That is unforgivable and should not be. We are Illinois. We are a large economy, and we've now been passed by Alabama and Mississippi. No deference to them. We got to do better. So we also have a very lean government, and per capita, the number of services that we have at the state are leaner than any other states, including education. So I think we're done cutting, would be my thought, and we need to be thinking about what are some ways in which we can work differently here. Now, we have, as Michelle referenced, the Early Learning Challenge Grant, Race to the Top grant. We have gone after every federal American Recovery Reinvestment Act dollar that came about, and you know that the federal budget is now, post-election, has to be dealt with post-haste in the next 60 days, less than 60 days. They have to resolve significant decisions around how money in the federal budget will be done. Otherwise, we'll all be looking at huge cuts across the board, including in education. So we can't expect now the federal government necessarily to bail us out with that. We've gotten a lot done through also private foundation funding. The Shared Learning Collaborative that I mentioned in my remarks is entirely funded by Gates and Carnegie. And, those dollars, they're able to bring in the best and brightest people to design a system that otherwise we would never be able to do independently as a state. And we're not just collaborating internally, but we're collaborating with other states across the country. In that initiative alone, we are one of 5 states that are piloting that this year. I believe there's a substantial savings potential in working across state lines to do some of the same things. We don't have to redevelop these systems 50 times. This doesn't make sense.
Michelle, do you want to jump in on this one?
Yeah, thank you. Over the past 2 years, I would say, we've really unfortunately seen community providers, we've seen a number of community providers close. We all know that child care providers, provider centers, and others have closed, as have community agencies across the spectrum of different types of services. Family and community services, child-related services, mental health, alcoholism and substance abuse. All kinds of community agencies have closed over the past couple of years due to state funding drying up and also state slow pay. We have discovered, though, that the agencies that have been successful in diversifying their revenue sources have survived the best, if you will. They've been able to weather the storm. I mean, everyone's handling this with difficulty. Agencies are tapping into lines of credit, but those that have not given any thought to revenue diversification have been hit particularly hard. And so through Race to the Top and some of these other initiatives, the state is offering assistance, technical assistance and guidance on revenue diversification. So I encourage people to get involved and find out what resources will be available as this project unfolds.
Beth, do you have a comment on this one, or? Okay. I laughed when I got this question. How many times have we heard this question? What happened to the lottery money?
We always get that question.
Yeah, I know. Yeah. I almost can answer that.
Yeah, so go ahead. No, I'm going to hear the obvious. So what happened to a lot of money? I'd like to know that. It goes into the general fund for common school fund.
Yes. Common school fund is now used primarily for pensions.
Yeah.
Well, it goes in the common school fund, and what happens is that it goes there, but then the legislature just decreases the amount of other money that goes there. So technically it is there, but you don't see it as an add-on.
And just in defense of the pension discussion, because I also, as state superintendent, fortunately serve as president of the teachers' retirement system. Go figure. So that, so the state has not paid the contribution over many, many years, which has led to the crisis that we have with pensions, which also must be solved before any of us are seeing any sort of reasonable budget resolution here in the state. So, those annuitants pay money into the pension. Had the annuitants money and all that money the state owes been paid over the years, we would not have a problem with the pension system at all. So, we're there now, though, and we're there deep, and there has to be some resolution to it. And likely, a part of that may be other folks picking up the tab for that, including districts, which they're very concerned about because that's only going to take away operational money. Education is largely about, as you well know, people who serve our kids. And we had 8,000 teachers retire last year. We had 8,000 fewer students. We only had 4,000 new teachers coming into the system, and we need that to remain an attractive profession. The average pension is $40,000, just so you know, not a huge amount of money, and they do not receive Social Security benefits. So it's another poverty, wealth issue, but it's one which we should at least have a general awareness of.
For each of the last, I don't know how many years, I thought, okay, the crisis has gotten so bad that surely they're going to fix it this year. And they never have.
No. So
Is
the
there any
underlying
reason to
problem was-
believe it's going to be any different?
The solutions that are on the table now wouldn't deal with the systemic underlying issues, and, the pension ramp and the fact that we owe so much money for such a long period of time undoubtedly will require new revenue sources. So I think if you see proposals or plans come forward that don't have that as part of the package, you're right to question it.
Jerry Sturmer this morning reported at a meeting that he's been doing some work in looking to see how long the pension systems have been neglected and where the state has not been doing their share and these systems have been underfunded. 70 years. 70 years was what he reported
Yeah,
this
it's
morning.
never been funded. The state's never made a contribution since the 1950s.
I mean, Chicago's actually was pretty well-funded until about 10 years ago, and it took a dive.
Yeah.
But that's because it's Chicago property tax.
Relative, yeah.
Right.
It's quite good.
Okay, this question may be especially for...
Well, pension humor, sorry.
Okay. And you're not going to share it with us? Okay. This may be for Chris and anybody else. What efforts are being made to streamline the process of referring, placing, and tracking students through the IEP process?
Well, we have the student information system is where that's going to happen. So all the special education information is being put into that this year. Every student has an identifier number, which is a way to help with this, including kids' transition. So remember, this longitudinal system is going to allow us to follow students even when they leave K-12 settings and go into community colleges, higher education, and eventually into work settings so that we can figure out how successfully kids are tracked. And also, because we're including information from kids at birth, it also helps us on the front end of the system in making sure that those students are identified early. We still have some work to do. There are significant needs identified as we work together on the early learning challenge, in particular around transition data of students coming in from the early years. But the good news is that we had some money and some focus on that, so we're able to at least start to address that in a meaningful way.
Listening to your description of what's being tracked, which is really very exciting, getting beyond just standardized test scores, I'm also putting myself in the shoes of maybe a principal teacher and thinking, this is overwhelming. It sounds like I'm going to be filling out forms and reports and whatever.
Yes, I can tell you without a doubt that teachers and principals right now are feeling a lot being overwhelmed, in part because of the advent of Common Core standards, and we just, are rolling out the efforts of Senate Bill 7 in the new evaluation system, so every administrator in the state was trained over the summer, some under lots of duress and during vacations, which we heard about. But nonetheless, what we heard also from our superintendents and principals were that for many of them, it was the first time they had gathered together as a faculty to talk about what good instruction looks like. We use Charlotte Danielson's model, which includes a videography of classroom teaching. We think that was, a good model to use and one in which we can build on. And again, we're not doing this alone. It's a model that's been validated across other places in the country and one in which I think we can grow over time. We have to get to the pre-service issue, and we have been focused on that as well, making sure that when principals and teachers come into the jobs that they have the skills and knowledge to do as effectively up front. It has to be a continued focus, and we have quite a few efforts going on there, in addition to identifying even the role of an early educator and what they should know and be able to do, and identifying them as having those skills beginning working with students at birth, which is a whole other skill set, as you know. But we have to make sure that the professionals we're putting in front of kids actually have the skills and knowledge to do those jobs in order to get the data and the results that we want.
Is there any paperwork reduction?
There is paperwork reduction because the Longitudinal Data System Act actually requires it. So we've had eliminated already about 9 reports that local school districts have had to report on, and we're able to even, as Michelle was pointing out, there's going to be other opportunities when you look across agencies for even reducing that further, and we've got to keep working on that. The surveys in the Essential Learning Survey that I mentioned are online. Parents can go online and teachers and students to do those, and they're compiled and will be fed into the new report card. The new report card, if you haven't seen it, will be rolling out next October, is much more parent-friendly, citizen-friendly. You can get information from it very easily around another domain, a number of domains outside of academics. So we've had a need to focus on other things other than academics, and I think the direction we're moving will take us there. Once our waiver is approved, we'll also be able to further enhance that. We are going to be moving to a growth model so that we can show growth for all students and subgroups. Schools will be rewarded for how fast and how far they go in closing those achievement gaps, and we're already rolling out a number of initiatives with our testing to focus on those things as well.
What do you need waived?
Well, we'll be waiving the requirements of No Child Left Behind Act and the designations of AYP. We'll have no districts making AYP before too long, and this, in fact, just last week when we announced the AYP results, which we had froze from last year to this, we said this will likely be the last year in which we do that. So instead, they would be able to get credit for closing achievement gaps and be rewarded for that versus having all students meet by 2014, which no one's been able to really obtain.
Okay. I have a question about fairness and the suburbs. What is being done to allocate resources and outreach efforts in fair proportion to the suburbs, where poverty and the immigrant community and ELL communities are rapidly growing?
Did you want me to take that? We're talking about education funding. So we have the formula I mentioned is the major distribution method for funding in the state. One source of funding that the suburbs also focus a lot on are what we call the mandated categorical funds, which include reimbursement for transportation. You might recall a couple of years ago, transportation funds were decreased substantially. Our suburban districts care a lot about that. Whatever is reduced, essentially a local district has to make up elsewhere, usually from local money if they have it, so if they'll have money in the reserves, or if they can also borrow more. So the general stated formula lays out, and also it's a complicated formula, includes the equalized assessed valuation of property, which is controversial, so zip code does matter in the state and shouldn't. That's very apparent to us, not only in suburban districts, but in districts for which we are intervening, such as East St. Louis, North Chicago. We've had, just last week, we had another district come forward struggling to make payroll this year. So, again, when you prorate money or don't give all the money that a school district was expecting, they've budgeted for it, they've hired people, they've entered into contracts. That's all done before the budget's passed, so they're then faced with a really terrible scenario, particularly if you live in a community that has nothing left to tax, or for which the tax rate is very high. So a Cahokia, a Cairo, we have a number of communities in the state like that are really suffering right now.
Okay. We've heard about the new kids assessment. Will districts be able to eliminate other assessments, particularly in half-day kindergarten?
I don't know. Raina, what do you think? We are cognizant as we add other assessments and surveys. I will tell you, though, for the money that we spend on early childhood, I'm really concerned that we don't have better data than we have of kids' readiness when they come into school. If I could sacrifice any of the 3-8 assessments, if they weren't federally required by law, I would do it in lieu of something like a kindergarten readiness or any measures, even in the first and second grade. The earlier we intervene, as you well know, the more effective. It makes good policy sense. It always does. Prevention, prevention, prevention. Get to kids early, get to the issues early, and it would make a ton of sense. I might even be willing to look at sacrificing the 12th grade in lieu of early childhood. I mean, it's that important. And how well do our kids use 12th grade now? It's a legitimate question to be asking.
When I think about, integrating services, my mind tends to go to physical space, and there are a lot of empty physical spaces in the city of Chicago schools. I'm now switching away from schools in particular, but the idea of bringing resources together into a community, is there any discussion about, using schools as a place to have that happen? Service delivery?
There's discussion definitely at the city level. I don't know if you're going broader than that, but looking at whether it's school buildings or we're looking at facilities in general. So even, rather than building libraries separately, if we're building a new school, maybe attach the library there, be a community resource as well as serving that school. So we're trying to get more strategic around how we're, looking at our facilities as a whole, regardless if it's a park district facility, a library, a school building. We do have school buildings that are empty in the city, and we're also looking at where they are. Could they do health and human services? Could that be retrofitted into more community-based programs? So those conversations are happening. We don't have the details or the plans or the timeline yet, but a number of commissioners across the city are actually having that dialogue now. It's something we'd be interested in exploring, for sure.
Okay, I have another general reporter-type question. Often you need a crisis to get something really important changed, significant changed. Is there any good news coming out of our crises? Mainly financial?
Well, the American Recovery and Investment Act dollars that came from the federal government were largely as a result of the crisis at the federal level, and I think we've used those well. I think we should have gotten a larger share of them in some cases, but nonetheless, what we've gotten, we've made hay with. And so, I think that's good. I'm concerned about the federal crisis and the climate that Congress will have in resolving issues now going forward, particularly, if they don't, remember, it's law now that we're going to be taking hits in January. That's the problem. That's what the law says. Unless they change it and resolve and come to some reconciliation around how money should be allocated. So that crisis is still building, I would say. But I think, at the state level, again, we're in a pension crisis. The Teachers Retirement System Board took an actuarial basis, basically saying we can't count on state money anymore, and we now have 3 scenarios that look at insolvency of a pension fund. We are the lowest funded pension in the country. It's a pretty big crisis. I'm waiting for results on this in January. But I think, we're still building somewhat on the crisis front. That's a guarded answer.
Yes.
For many of the other human service agencies, the crisis, the overall state crisis, fiscal crisis, is resulting in major reforms in Medicaid. And the election has many implications for Medicaid funding nationally, but the way the state is responding to a large part of the pension and the overall fiscal crisis is through Medicaid reform. We are among the very last of the large states to put our Medicaid recipients in managed care. So for instance, most of the other large states already have Medicaid managed care. We are now in the process of Medicaid managed care reform. This is something that I just need to report in a very neutral fashion, but let me tell you some of the facts, and this will impact the families that we serve. By law, by January 2015, 50% of all Medicaid recipients in the state of Illinois must be, shall be, will be in some form of integrated or managed care. I have word from our sister agency, the Healthcare and Family Services Department, as well as from members of the governor's office, that speed needs to accelerate, that rate needs to accelerate so that up to 85% of Medicaid clients shall be or must be in managed care by January of 2015. While at the optimistic end of the spectrum, many people have hope that this will result in more positive health outcomes for Medicaid recipients. More coordinated care can lead to more positive health outcomes. I think that we all want to remain vigilant and make sure that questions are answered about the services that will be available and how this impacts our families.
By managed care, do you mean like an HMO? Or?
The Healthcare and Family Services, the Department of Healthcare and Family Services is unrolling this initiative in waves. First is through their Integrated Care Project, and that is concentrated in some of the Collier County areas where people who are seniors or persons with disabilities on Medicaid are going into managed care through under the umbrellas of two large managed care organizations. The second wave is what HFS is calling the Innovations Project, and here they, or we as a state, put out a broad RFP for managed care entities and/or coalitions of providers who are interested in coordinating care. So this is a positive thing because we are looking to diversify beyond traditional managed care organizations to non-traditional care coordinators, non-traditional community-based care coordination entities made up of our providers. The response was not overwhelming, it was less than overwhelming, and we are hoping that more providers come to the table because this is the way that healthcare will be done for Medicaid in the future.
Okay, interesting. Two more questions about assessments. Can you eliminate the RTI assessments for kindergarten once you've implemented KIDS?
Well, the response to intervention, again, not dissimilar from KIDS, which is looking at other domains, and additional domains, is around trying to find and identify problems early. So, districts are in early childhood programs are going to use probably a whole menu of items, many educators do, in trying to assess the needs of kids. But in general, the notion of responding early and intervening is going to be one that stays, regardless of what you call it and what instruments you use to that end. So that would be how I'd respond to that. I wouldn't say that you're going to, hopefully you won't eliminate the idea of just intervening early and using good data and information to do that, because that's what all these are all designed to be tools to help educators do that.
The other one, in measuring academic achievement, has the state board ever looked at other assessment tools other than testing? For example, portfolio-based assessment.
Yes, we actually had a run with a portfolio-based assessment for kids with disabilities in the state several years ago, which we used. It was, teachers felt to a large degree, to some extent, it was an evaluation of them versus the student. They were fairly involved in terms of their grading or scoring. It requires you to send off the portfolio somewhere and have them looked at. So there's thus a lot of cost associated with that. We are, of course, part of a national consortium looking at a new evolution in assessments, the PARC assessment, which will be through course assessment. No longer will be just one assessment window period, but several throughout the year. And again, this is designed to help give teachers information sooner so they can intervene early. And the standards lend themselves towards the application of knowledge. So the entire country will be moving away from the notion of a multiple choice bubble test to one in which student knowledge will have to be applied as an answer. We've already piloted that in our ISAT test the last year, and this year even more, and next year even more fully, so that teachers and students will be able to be exposed to that. And that obviously has a lot of implications for instruction, so we're trying to make sure that everyone is up to speed on that. So we are going to see a substantial change in evolution in assessments.
Yeah. Beth, are you in a position to talk about the transition from current testing and CPS into this next one? Because, right now, it's an alphabet soup of testing, and there's a lot of,
Probably not the detail that you would want to.
Okay.
Yeah.
I've run out of my questions. Have you run out of yours? Okay. Well, join me in thanking a fabulous panel.